How, you talk about feeling it and, feeling it in your hands. And I know that with craniosacral therapy, you're not actually putting...
No, you are.
You are putting hands on them? Okay.
Yeah. Reiki tends to be a little bit more off the body, although the way I practice Reiki, you're usually right on.
Okay.
A lot of people tend to think Reiki is usually totally hands-off. Craniosacral therapy is the other way around. It's almost always very much hands-on. Maybe you'll go off occasionally, but then you come back on. And that is more how I work.
Okay. And so, you talk about this kind of developing the ability to feel the more subtle changes, and how aware do you need to be to kind of even get into this line of work? Because
it's training, right?
Okay.
Just like anything else. But what you are training your hands to do, it's a very right brain process. You actually have to sort of disconnect your left brain sometimes, and it's like, well, this is completely idiotic, but if I were to feel something, I would feel this. And, and a lot of times in these first classes, they're like, okay, forget about the it's completely idiotic part. Let's go over to the what you would feel if you were to feel something. And that's actually how a lot of times intuition works. So the question is, can you train your intuition to be actually giving you very important pieces of information, because your intuition, because it's right brain, is very oriented towards, sort of a global analysis. And you might not be able to understand necessarily why you decide to put your hands in this particular spot. It's not usually a process of, okay, I'm going to do this because I want them to release somewhere else. But when you get into the groove of it, your hands go places. And you're like, oh, okay, I guess I'm going over here. And it all ends up making sense because of the effect it has on the tissue of the person that you're working with. And that's the other thing that is really important about craniosacral therapy, is it all comes back to what the tissue is doing. So, you may be guided by intuition, but you're in the right place based on what the tissue's doing.
And so when you say what the tissue's doing, do you mean like the person winces, or is it a physical reaction? Or
So what happens is that the tissue will change as you have your hands on it. So, like let's say I have my hands on somebody's leg, just here, and then what I'll be paying attention to is what's happening underneath there in this very physical space, of the tissue. And, I might talk about emotion, I might talk about all these other things, but you definitely come back to what's happening in the body and in the tissue itself. And there's these signs of tissue release, which can include like a feeling of heat coming off of it, or sometimes heat going into it. Sometimes you'll see a throbbing or a buzzing feeling, or you'll get a sensation of the tissue sort of lengthening or softening or changing in some way. You also can get a sensation of increased blood flow, or sometimes there'll be like a sensation of, granularity in the tissue that changes, all of those kinds of things. I think also there's probably some very significant electrical changes that happen that I think are also perceivable. Sometimes people will have a more global response. You'll see their eyelids fluttering. The significance detector, as I say, is experienced as a stop, and there's different levels of it. It's like a person's going deep, oh, they're going deeper, oh, they're going even deeper. And so if you're guided by the significance detector, craniosacral therapy trains it as a stop in what's called the craniosacral rhythm, which is kind of complex. But the thing to think about is that what you're perceiving is really the sensation of it's almost like a heightened awareness kind of stop, like, oh, what's that? Oh, there it is, And again, you don't have to know what it's about. You just have to be able to feel it, and that's training.